Good afternoon. Over the last few months, the pandemic has caused significant hardship for Montana industries, businesses, and workers. While there have been numerous challenges, we've been able to begin a path toward economic recovery by ensuring there are benefits for workers and families in need through existing resources and the 31 relief programs that we've created to date with the Coronavirus Relief Fund. While last week 17,123 Montanans received unemployment benefits, if we go from the start of the pandemic, more than 100,000 workers have received benefits from the state's unemployment insurance programs, ensuring that they could continue taking care of themselves and providing for their families. We're fortunate that Montana has prioritized a robust unemployment insurance trust fund. But over the last 8 months, the trust fund has dipped from $365 million in March to $202 million at the end of September. The trust fund is supported by a tax paid by thousands of Montana businesses to ensure that their employees receive benefits if they're laid off. The amount paid is determined each year largely based on what the trust fund balance is each fall and its ratio to previous years. Because the fund has dipped significantly this year, after several years of record low unemployment in Montana, the new tax rate set to be determined on October 31st would cause most Montana businesses to face a rate increase of at least 85%. Businesses have already been hit hard once due to COVID-19. The last thing we want is to see them hit hard twice, impacting their bottom lines for years to come. That's why I'm dedicating $200 million in coronavirus relief funds to boost the Unemployment Insurance Trust Fund immediately. This infusion will effectively double Montana's Unemployment Insurance Trust Fund, and it will prevent over 43,000 businesses from being hit by a significant spike in rates, while also ensuring the Montana Department of Labor and Industry can continue to paying benefits to those in need. The department will not have to raise rates on participating businesses in 2021 or in subsequent years. With current projections, this will save businesses well over $200 million over the next few years. Keep in mind, as with any year, individual businesses may still move between rate schedules based on their specific experiences. However, these shifts are minor compared to the avoided overall rate impact that would have occurred without the transfer. In addition to looking out for businesses and workers, this action will keep us being the state of Montana, from borrowing funds from the federal government to shore up our state's trust fund. You know, after the Great Recession, it took rates approximately 8 years to return to the rates prior to that economic meltdown. And we're not going to let that happen here in Montana. The boost to the trust fund will have a real impact on the ground for businesses next year and for years to come, playing a significant role in our state's economic recovery. Now about the concerning increase in COVID-19 cases. In the past 2 weeks, the number of weekly reported cases has doubled, from 1,249 to 2,451. The last county in our state without a case, Petroleum, added their first case this week. 31% of all the cases reported in the past 7 days, approximately 800 of them were from 2 counties in our state, Yellowstone and Flathead. Community-wide transmission is being reported from many counties. We're still seeing cases in congregate settings such as long-term care facilities, schools, and correctional facilities. Some of the counties that have seen significant increases over the past week are mostly related to outbreaks in congregate care settings or from events occurring where individuals did not take recommended precautions such as social distancing and mask use. For an example, in Deer Lodge County, a wedding spiked community transmission. Toole County cases are related to an outbreak at the correctional facility. And in Beaverhead County, there's a cluster connected to UM Western students. With this volume of cases, hospitals in some areas of our state are seeing strains. When you have more cases, you're going to have more folks who require hospital attention. And when you have more cases, this puts our healthcare workers at greater risk of contracting the virus themselves, and if they do, putting them temporarily out of work and limiting much needed experts to care of patients at the hospitals. More cases and greater community transmission mean a greater likelihood that business owners or their employees could contract the virus, causing a business to temporarily close. This harms not just the business, but harms our efforts as a community toward economic recovery. And we know, too, that a high volume in cases can strain local public health departments, causing delays in critical work that needs to be done to slow the spread of the virus through case investigations, contact tracing, and making sure folks adhere to quarantine or isolation measures. The over 200 cases in Missoula County reported on today's map is catch-up from the surge in cases reported and from reconciliation with the state over the past 4 days, with 43 of those reported today that come from yesterday's daily count. As public health was focused on contact tracing and control measures initially, and have since had time to catch up with and report to the state their case counts. If we keep trying to return to the way that things were before COVID-19 too soon, we delay our actual return to that old normal. Pandemics don't go away on their own. And they also don't spread on their own either. It's our actions as Montanans that have brought our total case count to over 16,000 and to nearly 200 deaths. It's our actions as Montanans that have stressed our hospital resources. And it's our actions as Montanans that can flatten the curve, stop the onslaught of new infections, and ensure there's enough hospital beds and ventilators for folks with severe cases or for those that need care for non-COVID-19 related issues. But don't take that from me. This week, over 230 healthcare providers in Montana teamed up to share with their fellow Montanans their concerns and their call to action. As they wrote, quote, "The situation's more serious than it ever has been in our state. New case counts and hospitalizations are hitting record highs nearly every day, and tragically, more and more Montanans are losing their lives to this disease. Our healthcare systems here and around the region are being strained under this pressure. reducing the spread of disease is the most powerful tool our community has to fight the COVID-19 pandemic. We're working every day to prevent this, but will not be successful without your help, end quote. These healthcare professionals ask of Montanans to take the preventative measures we know work and follow the guidelines or directives we currently have in place. Quarantining if you're exposed, staying home if sick and getting tested, wearing a mask, avoiding gatherings, and more. They also ask that we patronize the businesses that prioritize our community's health. When we began gradual reopening of the state, we did so knowing that at times certain communities might experience outbreaks and that more restrictive actions might need to be taken to address certain community needs. And throughout the pandemic, I've issued statewide directives that set the baseline on where we should be as a state as a whole, while allowing local jurisdictions to be more restrictive if it's necessary. For example, with increased cases on the Blackfeet Reservation, they've responded with implementing a 14-day stay-at-home order that began on September 27th. Fort Belknap did similar starting last Friday. And at the same time this week, the mayor of Billings called on the community to do better. Well, the Yellowstone County public health officers communicated that unless case counts get under control in October, control measures such as limiting business hours and occupancy will be instituted next month. There are some areas of real concern in our state. Yellowstone County is one of them, as community-wide transmission continues to occur. Flathead County also continues to experience widespread community transmission. I'd hope that those city and county elected officials are having a press conference every week as well on what steps they're going to take to mitigate the spread in their communities. The cases in Billings, the statements made by their healthcare providers and hospitals, and the clear direction that if they don't get things under control, businesses will have to be reduced to 25% of capacity. That should be a wake-up call for that county. And if the leaders in Flathead County aren't discussing additional steps that they should be considering, they're not serving their communities as well as they could. At the same time, at the statewide level, we remain committed to providing the tools that local communities need. Our state public health team is happy to assist local teams as they review their data and look at public health interventions. We always welcome local communities communicating with us when they need additional support. And from providing personal protective equipment to testing supplies and boots on the ground personnel, at the state level we'll continue to diligently respond to resource needs to the best of our ability. As of today, we've assigned 85 personnel, principally to tribal areas, tribal communities, 53 Guard and 32 civilians. That includes RNs, EMS, tracers, drivers, and incident command. We're working to fill requests of an additional 27 personnel, 12 of whom are registered nurses. I and also so many Montanans have heard over the past week or so that in some areas our healthcare facilities really are being strained. Starting first thing tomorrow morning, we'll begin posting a daily update of the status of COVID-19 hospital capacity in Montana. This reporting will include a statewide snapshot of beds, ICU and ventilator capacity, including a regional breakdown of inpatient beds occupied. It'll also include information specific to hospitals across our state, from our largest hospitals to specialty hospitals to critical access hospitals in our rural areas. The information will display inpatient bed capacity, ICU availability, and ventilator availability among these hospitals. It's most important to keep in mind that we're asking of our hospitals to report updated information to the state. Therefore, the daily updates only considered a snapshot in time. Bed capacity can certainly change quickly, and the real-time numbers may vary from state to state. I'll now turn it over to Jim Murphy, the head of the Communicable Disease Bureau, followed by Dr. Greg Holzman, our State Chief Medical Officer, to discuss our state's continued response and coordination with our hospitals.
Thank you. So I'm going to go into a little bit more detail on some of the numbers that the governor mentioned. Of note, today we did publish on the website the up-to-date version of the EPI profile that is put out every 2 weeks. In the EPI profile, you'll see that for the third consecutive week, we reported significant increase in the number of COVID cases across the state. This recent week is a 40% jump over the last week, which was already a significant number. That's where our 2,451 cases come from. When you look at the end of the report, it details the trend line for each county. What we looked at and saw was 18 counties across the state had what we would consider significant increases. In some cases, some instances, their cases doubled. In others, they had double-digit increases. On the positive side, we did see a few counties show improvement. Bighorn, Roosevelt, and Rosebud counties all showed significant improvement when compared to the week before. And a lot of this would be the result of some of the control measures that they've put into place. With the 2,400 cases reported in the last week, 1,300 of them, or over 50% of them, fell in a handful of counties. And that includes Cascade, Flathead, Gallatin, Missoula, and Yellowstone, our larger counties. As Governor Bullock indicated, with increased case counts, we are expecting increased hospitalizations over the next few weeks. Unfortunately, with increased cases and increased hospitalizations, we also expect increases in deaths to occur. To date, we have about 235 people that are currently hospitalized across the state in 20 different hospitals. And we have 193 deaths reported at last count. The hospitals that we've been talking to are stressed as we move into the fall season. Over the last few weeks, several have been at or near capacity, and a few have had to divert patients to other facilities. For that reason, that's why we're trying to provide more detail on what is going on with hospitals in Montana. As the governor indicated, that's going to begin to be reflected with a report tomorrow morning detailing some of the important indicators for every hospital in Montana. The hospitals are reporting this information into a national database. We are able to take advantage of that information, and we appreciate their cooperation with this effort. This information will be important for other facilities to see what the impact of neighboring facilities is as they make decisions about staffing and as they make decisions about being able to transfer people. Unfortunately, we're already seeing some difficulties from area to area as they try to transfer people to facilities that do not have staffing or room to support. Some of the indicators that we'll be looking at are just raw bed counts, ICU capacity, ventilators, and the number of people in COVID beds. This information is going to be useful for medical providers, but we also hope it will be informative for the general public. Right now, our hospitals are, for the most part, able to meet the other needs that come up in their communities. That's not going to be the case as we move into the fall if these trends continue. And that's why we think it's important to take some of the measures that need to be taken to kind of turn the tide of this. The increases we've seen in the last few weeks have been dramatic. And unfortunately, we're seeing people that are diagnosed now or people that were infected, 7 to 14 days ago. So it's going to take a little bit of time to kind of turn this around. And that's why it's encouraging to see some of the actions taken in counties like Yellowstone to address the problem, and also in the tribal areas, which have taken it very serious, and we're starting to see some of those numbers improve there. So with that, I'll turn it over to Dr. Greg Holzman, who will talk more about some of the effort.
Thank you, Jim. So as you can see, it's been pretty well highlighted that some of our hospitals in the urban and rural areas are under some stress. First, I do want to say we are very thankful that we have such dedicated healthcare providers, from the lab techs and custodial services to the nurses and physicians and many more who are giving tirelessly to care for our citizens. They deserve our gratitude and our respect, so thank you. As the number of cases has increased and the hospitalizations, as Jim brought forward, there is risk that we will have more times where the hospitals will reach their capacity and will not be able to accept patients for some time, whether that might be for a few hours or days. However, we know it's paramount that care is not delayed, and when patients from a critically accessed hospital needs to be transferred to higher levels of care, that they're available. Therefore, our larger hospitals across the state are partnering to assist each other in ensuring our citizens get the care they need. Each morning, we are currently reviewing the hospital needs and capacities. Our hospital preparedness program regional coordinators, who are employed by the Montana Hospital Association, are looking at the processes where they will be able to assist the community, the critical access hospitals find the right transfer for the right hospital if needed. The goal is to prevent delays and allow our critical access hospital providers to focus on what's most important, and that's taking care of the patient in front of them, not searching for an available bed around the state. To Montana citizens, it is incredibly important to remember that hospitals are open for care, even though they may be stretched at times. There was an article put out by the CDC earlier in September reporting that 4 in 10 U.S. adults avoided medical care because of concerns related to COVID-19. Delays or avoiding urgent and emergency care was more common among people with disabilities or people with 2 or more underlying conditions. These are not people that should be waiting. Even during the COVID-19 pandemic, people who experience a medical emergency should seek care without delay. Our healthcare system has been working to address COVID-19 in their communities since March. We have learned a lot. The hospital system, clinics, dental offices, etc., have implemented many prevention strategies to minimize the risk of disease spread within their institutions. It's important to remember, for example, a patient's outcome from something like a stroke or a heart attack is directly related to how quickly definitive care can be started. Please, in an urgent and emergent situation, do not delay. It's also important to have chronic health conditions under the best control possible. This is true at all times, but especially in the age of COVID-19. It is vital to make sure that you are managing your health, mental and physical, and keeping up with your routine care. Telehealth, or even now telephone care, has opened up many more options to ensure our citizens have access to care. So do be in contact with your healthcare providers and don't put off necessary preventive services. I'll now turn the microphone back to Governor Bullock. Thank you.
Thanks, Jim. And Dr. Holzman, we'll now open up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand's raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Maritza Giorgio with NBC Montana, and I have 2 questions. The first is about that catch-up in Missoula County cases, and we know several other counties still reporting much higher cumulative cases than what's on the dashboard. So is it fair to say our total cases are much higher than 16,000 at this point, considering that lag?
Maritza, for the first question, I'll turn it back over to Jim Murphy.
I think what we're seeing is that some of the counties that have larger volumes are obviously having some difficulties keeping up with that when you get 50 or so cases reported each day. I think most of the counties we're dealing with, though, have smaller volumes than that, so I don't think that we're significantly undercounting the cases as a result. Our EPI staff are working real hard 7 days a week to keep this stuff synced up with the counties as much as possible. Some of it is just inevitable with the numbers they're dealing with, but I don't think it's a significant difference in the number of cases.
Okay, thank you, Jim. And I'm also wondering, I mean, we're still seeing and hearing people not wearing masks. How can counties start enforcing this mandate for counties with 4 or more active cases?
How can counties enforce them? Was that the question?
Yeah, what's a way that makes this more enforceable?
Yeah, look, it's, first of all, like, there aren't requirements that you're wearing masks at every single moment, right? You don't have to be driving down a road in a car alone, as an example. If you're social distanced, you don't have to have a mask on the trail. But the level of enforcement, and it does lie at the local level. I mean, these are local public health orders. And if businesses aren't complying, if making sure that folks are wearing masks, and complaints should be brought to local public health. And it is one, though, you know, and again, more than the actions taken, is that we've all got to be doing this if we're going to change this dynamic. And it's only by us collectively taking the steps, washing our hands, avoiding large gatherings, wearing a mask, that we're going to get our hands around this. Next phone question.
Hey, Governor, Troy Shockley from the Montana Radio Company. You've been talking about, and again, of course, mentioned today, the local control of local health authorities. Is there a point at which you take control, the state takes control and says, you know what, we've hit whatever that benchmark is, that we need to take more drastic action statewide? And I guess if so, what is that benchmark? What is that point?
Well, Troy, I think that, look, and what we've done throughout, right, is set directives that apply to the whole state. Now, we also know if folks are going to follow those directives along the way, that's what's going to limit the community transmission. But you have some communities and some counties where it really is under control. So it's certainly, as you look at, like, going back to phase 1, it doesn't make, to me, much sense to do statewide where we know where a lot of the problems and challenges are. So in those areas, and I think that's why, look, I applaud Yellowstone County for saying these numbers are really concerning. And we need to get our hands around these numbers, or we are going to have to impose restrictions. And certainly, as I have done all for the last 7.5 months of this, we'll support local public health and those locally elected leaders as they do take more restrictive steps. Next phone question.
Hi, this is Perrin Stein from the Bozeman Daily Chronicle. I saw in the report today from BTHHS that the positivity rate is continuing to increase. So I was wondering if that is a sign that you feel the state isn't doing enough testing at this point, and kind of what the status of testing is.
So I'll answer the first part of that and then turn that over to Jim Murphy as far as what those percentages sort of give him from an epidemiological perspective. You know, over the last 4 weeks, we have completed over 91,000 tests. MSU is now doing testing 1,500 samples a day, 5 days a week. State labs running about 1,300, 7 days a week. MACO, our reference laboratory, continues to accept as many samples as need to be tested. So it's not necessarily that we're not testing enough, but I'll turn it over to Jim for his perspective from the epidemiological side.
We've been watching the positivity rate closely, and it's important to remember that, like most of our data, that's a snapshot in time. And we are concerned that it's at that 10% mark. One thing I think we have to note is that because of our spike in cases that we've been experiencing, we have highly targeted testing efforts going on as we focus on close contacts and symptomatic individuals. If the locals are doing good investigations and identifying the close contacts and then getting them in for testing, you're going to find more positives. So that positivity rate is going to increase. So I think part of this reflects targeted testing that has been very effective identifying positive folks. Could we do more testing? We are looking at expanding some testing into some areas that are considered hotspots and doing some folks that are not close contacts and who are not symptomatic. That's going to impact some of the positivity rates as well, but we want that to be focused. We want that testing to have the best value in those areas. We've recently done some of that in some tribal areas. We're working with Silver County on something like this as we speak. So we will see more testing in some of these hotter areas, and we'll continue to watch the positivity rate. And I think Dr. Holzman had a comment on it as well.
Jim, for the most part, answered all that. I just want to say from a clinical standpoint, again, it's working with denominators and numerators. So another aspect that this higher positivity rate shows is that we have higher disease in the community. And one of the other things that we have to do, along with all the other aspects, is to bring that disease down in the ways that we've talked about multiple times before.
Next phone question.
Hi, Governor Bullock. This is Samuels with the Associated Press.
Hi, Iris.
My question is again about this local control issue. I'm wondering why you thought back in July that a statewide mask mandate for counties with over 4 cases was appropriate, but you don't think that it would make sense to have a statewide mandate that would, say, require businesses to limit capacity in counties that have over a certain number of cases per capita or a similar kind of rule?
Well, look, it's something we can look at down the road, but it's also local government has the tools to do so. I mean, they know the counties where there's significant transmission, and that's where I think locally elected leaders have to be standing up and saying that they can do more to make sure that we get the buy-in. And again, I'll say, look, a whole lot of businesses are really doing a great job. A whole lot of places are. So it's something we can look at down the road, but all the tools are there to limit the spread and transmission if we'll only be adhering to those and utilizing those tools. Next phone question.
Hi, Governor. This is Jonathan Hettinger from Montana Free Press. I've been talking to health officers in many counties across the state that report that COVID is being spread by sick people who are going to work and then trying to hide that they're sick or going to work even though they're sick. And I was just wondering, is the social safety net adequate right now to help protect workers who feel like they can't miss a paycheck if they get sick?
No, I don't think it is, Jonathan, to tell you the truth. First of all, look, if someone is sick or asked to quarantine, they need to do so. Because that's actually what will limit community spread. But no, I don't think that the social safety net is adequate right now. And I mean, I think it's frustrating in as much as, I mean, we worked with as but one example, right? Worked with the Trump administration to have enhanced unemployment benefits for quite some time. And that money ran out at the federal level. And it would be good, to say the least, if the federal government, and that being the President and Congress, would get its act together to pass another package. I mean, this pandemic has impacted so many facets of our daily lives, and it's hurt Montanans economically. And this isn't the time to just be playing either stalemate or politics with people's livelihoods. We'll continue to do everything we can at the state level to both help Montanans and businesses recover, including with like that unemployment trust fund that we talked about today. But I think more needs to be done, certainly. Next phone question.
Hi, Governor. This is Tristan Scott at the Flathead Beacon. Thanks for taking the time. Since you mentioned Flathead County specifically, you recently reported that our county leaders are still deferring to the state for guidance on whether they take additional steps or tighten restrictions on businesses. And although they've articulated their concerns about the spike in cases here, should they anticipate any executive action from your office, or is the ball entirely in their court? Because it seems like a yield goes round and round kind of situation.
Well, I'd be happy to call them. And I hope that they're having a weekly press avail for you as well, Tristan, because it doesn't make sense necessarily for I, as a governor, to say, all right, we're going to put restrictions in place in 2 counties. First of all, I mean, Flathead County is an example. We know that there ought to be, and there are directives as far as crowd sizes and community gatherings. And we certainly know that you hope that Flathead County, like every single county, is following that along the way. And if businesses aren't following the statewide directives, well, it's up to the locals to actually enforce those directives along the way. So, I've never met anyone in Flathead County, and especially Flathead government, that has asked me to take over their government. So I'm on the one hand, more than happy. We'll try to arrange a call with the county commissioners to express the same concern that I'm addressing here, and concern wherever there's significant community transmission, that it can't all be solved from Helena. That there's local responsibility here to do what they can to curb this virus. Dr. Holzman.
I would like to say something for our local public health folks. You have a lot of great knowledge and great training in many of our local public health areas. And they're keeping up with the data, they're keeping up with the guidelines. But they can't do things without the support of their communities. You can put in all the different orders and all of that sort, but they need to have a community support. And so that's why another point, it's not just asking local public health to do this or to do that, but also supporting local public health, saying, we as the community, let's get together and address this issues. We know what we need to do, we just need to do it.
Next phone question.
Hi, Governor. This is Catherine Houghton with Kaiser Health News. You all have talked about the state's work to build a list of healthcare workers willing to fill staffing gaps where needed. Where are those medical professionals coming from, especially when we're talking registered nurses or CNAs or doctors even. And I'm also wondering what positions are most needed.
So I think as far as where they're coming from, that it's often, we call them volunteers, even if they get paid during the time, but it's, throughout the state. Some are retired. Some folks just have time on their hands. But and this is something that I even spoke to the administrator of the FEMA about today. I know that of the 27 requests that we have right now that we're working to fill, 12 of them are for registered nurses.
Governor Jessica Watts with,
Go ahead. Oh, you muted her?
sorry. Jessica Watts with ABC Fox Montana. You keep saying you're going to leave it up to local governments to kind of implement more restrictions. So with more positive cases coming in schools, kind of when will you step in to enact remote learning, things like that?
Well, Jessica, I think that underscores, right? Like, look, we knew when we started the school year that you are going to see some positive cases in schools. And the more that we collectively limit a community transmission, the less likely that they're going to be getting into our educators or our students. And we know actually that, like, even as we speak right now, because of that social event in Deer Lodge County, Anaconda schools were closed for 2 weeks. And I think Stevensville opted, just today announced that they'd be going into remote learning as well for a couple of weeks. So at the end of the day, it is by and large, I don't think that we're at any point that we would want to say, oh, schools all across the state should be closed down. And we've also provided schools both with some of the training along the way and the support to stay safely open and recognize that we are going to have some COVID-19 positive cases. And I think we'll continue to see individual districts saying, well, wait a minute, we're hitting a tipping point. And those tipping points are usually dependent on what's happening in that county.
Follow up with, COVID also impacting high school sports, kind of what are your thoughts on allowing, parents and fans in the stands?
Now, I think that from my perspective, and we've seen a few sporting events canceled, and that's because either coaches or players ended up with some positives and some quarantine. And I think, all throughout the state actually where those active sporting events right now, parents are attending. And as long as they're following what local public health in the district is saying, wearing masks and social distancing, I'm not aware of any transmission that has occurred from parents watching high school athletics. What's that? Catherine, you're back.
Grand. Hi again. Can you all hear me?
Yes.
Good deal. So sorry, my follow-up question was, are these medical workers coming from within Montana, or are we recruiting anyone from outside of the state? Just because I know healthcare worker shortage has been a national issue, but especially for a state like Montana, such a large rural state.
I'll turn that over to Jim Murphy as far as if you have specific details.
As far as Montana's system for recruiting healthcare workers to help out, we have a system called MAMAS, the Montana Healthcare Mutual Aid System. It's a website at mhmas.org. This is open to anybody that wants to volunteer. We do have a couple thousand plus now volunteers in that system. Some of them are from out of state. Anybody is welcome to go ahead and enroll into that system. We do have a need for not only RNs and licensed professionals, but folks that want help with contact tracing, for instance, can enroll in there as well. But there is a number of out-of-state folks. We have people that are snowbirds, for instance, that live in other places that come back to Montana that have enrolled in the system. and we hope that they will continue to do so because the need is still there. One thing that we would say is that there are a lot of requests out nationwide right now for this kind of support. So we are competing with a national demand for these types of positions, especially licensed professionals.
And how does Montana compete with other states?
Public lands, clean air, clean water.
Yes, we've been fortunate that, we do have a lot of people that, want to come to Montana, and that's where some of the snowbirds come in that do enroll into the MAMA's system. It is something that, clearly when the need is out there, for instance, North Dakota has asked for a lot of help with contact tracers. We've needed help with certified nursing assistants in nursing homes. There's more demand than there is positions or volunteers to fill them sometimes. But I think we do pretty well, but as a sparsely populated state, we have our challenges with this. So we would continue to hope that people look for opportunities like this to sign up.
Thank you.
Network. We have 16,000 cases in Montana since the pandemic began. My rough math puts it at, we have roughly a little bit lower than a third of those are currently active in the state. When you implemented the shutdown, when you implemented phase one, we saw a dip in cases. Why aren't we using that as a tool right now?
Well, I think, as I've said, like some communities are being much more restrictive, and we know, look, we've also learned a lot since then. So we know that the actions that we have to take, and certainly encouraging Montanans to take those actions. Next
Hi,
one.
this is Rachel Kramer with Yellowstone
Go ahead,
Hi,
Rachel.
this is Rachel Kramer with Yellowstone Public Radio. I was wondering if any counties have reached out to your office asking for more statewide restrictions.
Looking at least Jim and Dr. Holzman, not certainly that we're aware of.
Okay. And I had a quick follow-up question with your response to a question earlier today. You were saying that with a statewide mandate to limit capacity, I believe that was in reference to certain businesses, you were saying that it's something we can look at down the road. And so I'm curious, are there any metrics that you have in mind that would determine whether more restrictions would be needed?
No, there's not. I mean, as I said that, what I'm saying is we can always look at taking more restrictive steps, but we also know that, not every community is facing community spread. Many of our communities and counties actually have relatively good control over this. And we all need to be taking the steps because it really is one of these, look, the numbers that we see today as an example aren't just reflective of today, it's the activities over the last couple of weeks. But when 250 doctors actually sign up, and the plea wasn't for more restrictions, it was like, do the things that we know that need to be done. Where we see that along the way, look, we can get our hands around this. In some of our communities, it is more significant than others. And those communities, as well as all of us, certainly have to be vigilant to learn how to, as I also said many times, live with the virus still in our presence.
Thank you.
Last phone question.
Hi, Governor. It's Matt Bowles from KHN. Will you revisit the question of new statewide restrictions after November 3rd when maybe the pressure of the election starts to ease?
No. Look, we'll continue to monitor what the disease is doing every step of the way. This has nothing to do with it being, from my perspective, so close to the election. And unfortunately, it's, I think, in part because of politics that we're seeing increasing numbers. Because taking basic, simple precautions have been politicized. And in order for us to make real meaningful progress along the way, it needs to be depoliticized by folks on the ground and in their communities. And would hope that Montanans will be listening to the healthcare professionals, to their doctors and their nurses who are seeing those increases in cases, and to their public health officers, saying that we ought to be taking additional steps as well.
When you were able to issue a statewide mask mandate that accounts for counties that have low numbers with that threshold of 4, why can't you issue new directives that similarly targeted?
We could certainly look under the state's authority, could do all kinds of things, but the best way to do it from my perspective is much more surgical. And we know the communities that need to get their hands around this and address the community spread. Again, so look for the hospital report should go up starting tomorrow morning. And again, I'd encourage Montanans to take the steps we already know will change these numbers in our communities. And that is to avoid large gatherings. It is to wear a mask. It is to disinfect or wash your hands frequently. And it is to social distance. Thanks so much.